Next in line, my mentor, Dr. Arun Prasad.
Compared with what we have in the neighboring states and union territories. So therefore, congratulations are in order. That probably require to be reflected, that probably require to be spoken about, because this is not a time when you can be silent about things. Do your work and stay silent. We are not in a day and age where you do your work and stay silent. It's not how it is. I want to ask a question to myself and throw it to all of you. Irrespective of the faith that we profess, irrespective of the faith that we practice, be it Hinduism, be it Islam, be it Buddhism, be it any other faith, Sikhism. But as centuries passed away, we gave the mantle of leadership to the Western world. And I dare ask why. Of research and development and innovation in surgery, in medicine, in gynae-obs, in all other subjects that we possibly. You must possibly think about why we are falling behind the Western world. Why is it today that we still are slightly far behind what the West is doing in terms of innovation and research? I keep asking myself this question. The whole world might pick up and replicate that. It will not be possible unless we create an enabling ecosystem to do that. Be a great achievement. It might not be a big deal to all those big names doing this day in, day out as a bread butter. Anesthesia, it is a major deal and a milestone and a landmark for all of them. So therefore, we must possibly encourage peripheral depth here and make sure that we pull up all those people along with us, along with when you do this in terms of your own.
So it's for the health project.
You are aware that the Hernia Society of India and Government Medical College Srinagar today held a major event over the last some days, which is in the spirit of continuous learning and education in a tertiary care institution. Over the last some days, there have been massive surgeries conducted by renowned surgeons of the country, of which the junior colleagues here have got an occasion to learn, got an occasion to imbibe the professionalism, the skill and the training of these excellent doctors who are renowned all over the world, not just our country. I think such occasions provide a great platform for learning, a great platform for exchange of ideas, of skills and upgrading your knowledge, particularly in a setting like this in public health institutions. Some of the best names in surgery have graced this function and they have operated, and that operation has led to a lot of learning for all the young colleagues, postgraduate scholars, registrars, junior faculty members. Some of them have been pioneers in their respective fields. So I think that this is a great occasion where we should celebrate this success, and I am confident that all other medical colleges will continue to have this sustained continuous medical education, learning and training as one of the core principles of the functioning of the college.
Over the past some time, there have been some conferences held at the GMC. Now that with the first of its kind, this two-day mega conference, are we going to witness some revitalization of the infrastructure? We see when we have this kind of conferences here, are we going to witness any revitalization?
You will be surprised, you will be very surprised that we've got very, very positive feedbacks from these wonderful world-class surgeons who have come from across our country, from the north, from the south, from the east, from the west of our country. All these wonderful names have pointed out one thing, that the skill set and the infrastructure of our healthcare institutions in the public healthcare system is very good. So therefore we have a moment of pride in this. Also, you understand that there is a continuous requirement to upgrade our healthcare infrastructure. The government is doing that. The government is spending a lot of funds on continuous upgradation of our health infrastructure, and I am confident that in the times to come, our healthcare system will touch new heights and our healthcare professionals will get better and bigger opportunities of performing at the national and international level. Thank
your
you.
speech, you highlighted
Thank
about
you.
some specific budget allocation for the research purpose.
Inshallah.
So,
I think it is important that we understand that medical science is a very dynamic science. Medical science and knowledge and information keeps changing on a dynamic basis, on a yearly basis. That is why medical textbooks keep changing editions every year almost. So therefore there is a requirement to make sure that one part of our budgetary allocation must probably be allocated to research and innovation in tertiary care institutes like Medical College Jammu, Medical College Srinagar and SKIMS. This is also important because now we have not just 2 medical colleges in Jammu and Srinagar. We have round about 10 medical colleges in the government sector. The peripheral healthcare system has received a major fillip, and it is also important now that we must make sure that we utilize these opportunities that the government has given to the fullest in the interest of patients. And research, innovation, knowledge building and training capacity building is one of the core focus areas of the government. Thank